we're going to miss a little bit of the beginning of that on the YouTube. That's okay. All right. So thoughts, feelings, emotions, just movements of chi within the system. So the idea here is that when you stub your toe, you get local chi stagnation, and it tends to move some of your liver chi. Anger is not that different from that. These individual emotions are movements of chi within your system, but so is an injury. There's not really much of a difference when it comes to our treatment and our approach to it. When it comes to the subjective experience of you or me or a patient, there's a huge difference. But when it comes to how we interact with that as a practitioner, there's not really much of a change. So all experiences and movements of chi. This is how we're going to be defining emotions in this class. I'm getting this information from the work of Elizabeth Rochat de Vallée, excellent Chinese medicine scholar. I'll put up a link on the Slack to this book so you guys can see where it is. She's got a whole collection of books. She does classical Chinese medicine translation and teaches classes around the world, French. And she's one of the people, so one of the movements that's going on in Chinese medicine is trying to revivify some of the pre-communist Chinese medicine, because things like emotions were talked about very differently before and after Mao Zedong and Cultural Revolution. So a lot of this is pre that. The idea here is that movements of chi within the body, be they emotional, be they physical in their perception, are differentiated by whether or not the pericardium is involved. So an upward movement of chi within the person's system might be a headache, it might be vertigo, or it might be anger. And the difference is whether or not the pericardium is involved. So the same movements of chi, the same upwelling of chi, manifest differently depending on how it moves through the person's system and what organs it interacts with. Each emotion has a direction. I've summarized them. I like to do this graphically, so I've got this over here as well. So anger moves outwards, joy moves upwards, sadness and grief moves inwards, fear and shock move downwards, and rumination moves around. I'm gonna just show anyone who's closely watching the screen during the quiz saw me draw this. So this is our celestial cross. So wood and anger move outwards. Fire, joy move up. Metal and sadness. Water and fear. Earth and rumination. So the first presentation of that, here, if anyone's still looking at that, I can keep that up for a minute. So the first statement I just made is that anger moves outwards, but that's not completely correct. And we're going to be bouncing back and forth between these two ways of talking about this for the next 10 minutes or so before we take a break. Chi that moves outwards when experienced by the pericardium is anger. Anger doesn't move chi outwards. Chi moving outwards experienced by the pericardium is anger. And everything I'm saying for anger goes for every single one of these, just with a different direction. I'm just using anger because it's something that we have a weirdly easy time talking about within our culture, and the other ones we have a harder time talking about. We'll get to all of them though. Okay. So each emotion moves the same way as its associated element or phase does. It's pretty straightforward. This is from Maciocia. So we gotta talk about how Maciocia gets this stuff wrong and really how his generation of Chinese medicine practitioners gets this wrong. This has been updated somewhat within contemporary understanding, but the introductory textbooks have not caught up yet. So I'm just going to read this out. This is copy pasted verbatim from Maciocia. The word emotion itself is not a good term to indicate the Chinese view of the emotional causes of disease. It is interesting to note that the word used to indicate a suffering of the mind originally was passion rather than emotion. Passion derives from patere, which means to suffer. The word emotion replaced passion only between Descartes and Rousseau between 1650 and 1750. First using passion, latter emotion. The word passion would convey the idea of mental suffering better than emotion, also because it implies the idea of something that is suffered, something that we are the subject to. Indeed, feelings such as sadness, fear, and anger become causes of disease when they take over our mind, when we no longer possess them, but they possess us. Indeed, the Chinese expression in most Chinese books used to describe the stimulation or excitation produced by the emotions is 四字, where 字 contains the radical for water, meaning to swash or surge as a wave does. That is, it denotes the surge of emotions like a wave that carries us away. So that sounds nice, but at the same time, when you read all of this, it doesn't, and this is the main place where Machiosha defines emotions within his Foundations textbook. This doesn't actually tell us much. So emotions are something that carry us away, something that can possess us, okay, but it's a little bit different than that. It's a little more complicated. So one of the problems with a lot of this is that the cultural impact is hard to see. And when Machiosha is talking about emotions here, he's making the same mistake that we made when we said 5 elements instead of 5 phases, which is that we saw this idea within Chinese culture that, and by we, I mean sinologists quite a while ago who were really trying to understand this for the first time, they encountered this idea that kind of looks like the Greek 4 elements. And they went, okay, we can map these together. So the Greeks have the 4, the Chinese have the 5, they're both elements, we're good. But that was an incorrect understanding. There's a lot more nuance to it that separates the two apart. When Machiosha is attempting to explain emotions here, he's starting off by attempting to tell us what the Western idea of emotions are, as opposed to trying to understand what are we talking about in the first place within Chinese thought and Chinese culture when we're talking about these emotions that maybe can carry us away. So the cultural aspect becomes the water we swim in. It's almost impossible to see. This is one of the benefits of travel and spending time in other cultures, is it helps us to see our own, right? It helps us see our blind spots where we just assume things. So the idea that our culture tells us being happy is good ends up turning into a pathological desire to be happy, which you're going to see in some of your patients. I've had patients who come in with the chief complaint of, I'm not happy. But as we begin investigating what they mean sometimes is, I'm not as happy as the Instagrams of my friends make their lives appear. So judging, I'm going to judge myself versus what I think I'm supposed to be. And sometimes I feel sad, but I'm happy most of the time. Help. So not being happy has been culturally pathologized. And these normal fluctuations, these healthy fluctuations from a Chinese medical perspective, are seen as a sign that something is wrong. So looking at the emotions as a positive thing, they work well as servants because they aid us in the proper movement through the world. We should, in general, be moving through these emotions in a somewhat seasonal way. It's appropriate to be happier in the summer than you are in the winter, for example. When you're in the fire phase, that should come up. Being a little bit fearful and sad in some parts of the year, in Chinese medicine, we would say that's a good thing. This is your planning stage that helps revitalize the next year.
Peter, I have a question.
Sure.
Just along with that, does the preference for weather also go along with your constitution?
Yes,
because
usually.
Just for a personal example, I'm usually happy to have more energy in the wintertime.
Yep.
That would be considered more of a constitutional thing.
Yeah, generally speaking. I mean, there's a number of different ways to look at it. Some people are, there's heat versus cold, but then there's also the cultural aspect. So people who are introverted sometimes prefer the winter, but also people who are really excess and hot often prefer the winter because the cold balances them out. So there's the question of like, was the preference for winter a preference for the temperature shift and the decrease in light because that works better with your physical form? Or is it that the culture in the place that you live changes in a way that you prefer in the winter? So I know being in New York, like I love the fall and the spring the most because I don't really like the extremes of either the full summer or the full winter. Partially it's because the social expectations in the middle of the summer are way more than I'm really interested in engaging in. And in the middle of the winter, nobody really spends much time with each other because it's freezing cold. So that there's multiple variables to look at.
Thank you.
Yeah, please, like, I can get on a little bit of a tear. So just interrupt me if things aren't making sense or if you have questions. I'll try to check in regularly, but these are good. At the same time, we also want to have emotions. This is more of the Taoist side influencing Chinese medicine. The Buddhists are kind of comfortable being like, look, yeah, sure, things go through you, but you just let them go. And the Taoists are more of like, you're supposed to have emotions. You just want to have them correctly in relation to what's around you. So emotions are pathological when they lead to disharmony and they lead to the person becoming out of balance or sick. They're beneficial when the energetic movement that accompanies them is beneficial. So if through becoming angry, you're able to break through something, move through into a different experience, if you're able to change your life circumstances through your anger in a way that's beneficial, then the anger itself would be beneficial. If you should be angry, and as the anger comes up, you push that anger downwards and don't experience it and don't allow that energy to do what it's supposed to do, then that repression of the emotion can also be damaging to the person's system. We're gonna go just one more minute and then take a break here. You guys are doing great. So whether an emotion is expressed or not is gonna change its action. The act of expressing itself is also a movement of qi. One of the examples here is plum pit qi. We referenced this last week. It's a sensation of something stuck in your throat that you can't swallow, but you also can't cough up. This often is made worse or only arises when a person's experiencing emotions. And a lot of people, this shows up when they want to cry, but then this happens and then they can't cry. This is seen as the liver moving upwards, the wood energy moving upwards to express through speech and maybe tears, and the metal element coming in to control that and stopping it right at the level of the throat can also happen right below the sternum. So as you attempt to express, it's stopped and we get this congestion within the system. Expressed anger can also cause excessive rising of qi. So some people get angry in a way that can work well in general with people, and some people explode and see red and kind of lose some of their consciousness for a little while. That's going to be damaging in a different way than repressing the anger would be. So too much up, too much out, too much anger will cause a certain sort of damage. If instead of moving outwards, you retract inwards, that's going to cause a different type. A lot of people who come from families where anger was never allowed, where the expectation was that they be small and quiet, will very frequently get intestinal and digestive disorders. It's this energy that's supposed to expand moves inwards and knots instead, for example. And in general, these are going to turn into their opposites. So unexpressed outward movement looks like pathological inward movement. You see unexpressed sadness looking like protective aggression a lot in within our culture, in men who have trauma, but also have been brought up in a traditional perspective of what masculinity looks like. These are the people who can't cry, but when they feel emotion, they get angry instead. On the body clock, we treat this by opening up the connection between the liver and the lungs, for example, the last and first organs. And unexpressed anger often resembles a retreat into the self. So people who aren't able to express their anger, the opposite side, often begin to look more introverted or like they're moving away from things. We can get two more here and we're going to stop. The problems with emotions tend to come from attachment to them at the end of the day. So a big burst of anger is one thing, and that might cause some imbalance, might cause some disharmony within the person that we can help them with. Multiple things causing sadness in a quick succession can cause problems, but if the person then attaches to that emotion, it can often cause it to linger much longer. So we're very good just through acupuncture, not through counseling. Often we're going to talk to the person to hear what the issue is, but once we have the issue, just through using acupuncture, not even herbs, nothing, I mean, you can, but just through acupuncture, we can help people let go of attachment to these various emotions. There's a phrase from Heiner Fruhoff. Make a note to send you guys that article. This will be a reading for next week. There's a phrase, all emotions affect the heart, and all disease comes from the heart. And they're talking about internal disease here. But the idea is that the emotions that we experience create these diseases, and they have to involve the person's pericardium and heart interacting with them. So when a person has an emotion, that chi, or when a person has this movement of chi and it affects the pericardium, it agitates the heart. When correct, this is the spice of life. It keeps us moving. It keeps us from becoming too static, which is itself a type of disharmony. When this becomes pathological, it shakes the heart and scatters the shen. And when the shen scatter, we begin to lose that which we actually do see as ourself. This is, you can regain these things. It's one of the things that happens when people sit in silence and meditate. When they get that calm, quiet space, the shen is able to regather. One of the ways to easily translate this is the more stress you're under, the less time you have to step back and think about what's going on in your life. Think about whether you're on a path you want to be on. Think about whether you're doing what you care about. If you're consistently being agitated aggressively, you can only really be in a responsive mode. And acupuncture is a place where people can sit or lie down in a silent space while receiving care, which often allows the shen to return. We're going to pause here because you guys need a break. It's time for a break, but we're going to get into some of the other issues in Machiocha here. This might feel a little bit scattered, but we're setting ourselves up to go in and talk about each of the emotions one by one a couple times here. So let's take a break for 10 minutes and we will be back at 10:22. I'll be around for any questions that you guys have. Yeah, thanks.
Yes, Peter, could you please bring up to the screen that with directions of emotions one more time, please?
No problem.
Peter.
Yeah.
What are we like? I didn't do the quiz that was the link. What did you say we should do that now?
I'll send it out. You can do it after class. Just
okay.
Submit it today.
And is that because I'm having trouble getting into the Slack? For some reason, it doesn't find my email.
Okay.
So I have to be able to access Slack to access that quiz, right?
Nope.
Oh,
nope.
okay.
You just follow the link that's in the chat.
All right.
Yep.
Okay.
It's a Google form, so it's separate. You don't have to log into Google or anything like that either.
Okay.
Yep. The Slack is just working as a repository for documents. It's not mandatory. It's helpful, but it's not mandatory to be in it. All right, I can still hear you guys. So if you have any questions, let me know, but I'm just turning off my video for a minute here. All right, welcome back. Anyone have any questions from the break? This is, I understand this section of the emotional discussion is a little bit disjointed because it's a little challenging to get into a discussion of emotions. I think this might bear rewriting for next semester. Any thoughts so far? Any questions? Okay, well, let's get right back into it. Mm-hmm.
I was just to say, how do you encourage patients to discuss their emotions? But that might not really be, like you said.
Well, one of the nice things about Chinese medicine is that you don't really have to discuss emotions very much if that's not something that the patient's interested in. So very often in taking a pulse and listening to a patient describe their, patients come to us because there's something they want to have different in their life. They don't, if everything is good, then they don't come to us in general. Some do for preventative medicine, but in general, people come because they have something they want to change. And as you're talking to them, you listen to what they're describing about their issue, and you take their pulse and you look at their tongue, and that usually gives you enough space to ask them some questions about, like, so how do you feel about that? Is an easy enough place to start. And they say, this issue is kind of making me anxious, I guess, or like, I don't know, it makes me angry, it makes me sad. I just spend all this time thinking about it. Rumination for us is an emotion, so overthinking about an issue, it would be considered an emotional response. And that's usually enough for us to go, okay, that's really all I need to know. Oftentimes, what I'm looking for is the patient comes in, they're worried about moving from one house to another. Okay, that's going to disrupt their earth because the physical place they live is your physical manifestation of your earth. So I would expect them to be overthinking this and ruminating because of the effects on the earth element. So when I ask them, like, so how is the move going? How have you been feeling about it? What's been going on? And they say, nothing but joy. It's like, okay, so the fire phase is involved in some sort of a way here, as opposed to the earth that deviates from my expectation. And now the question is whether or not that's something that warrants any sort of an intervention. We don't necessarily need them to spend a bunch of time talking about the depths of their fear, why they're afraid, what's going on. If they want to share that, I'm not going to stop them, because sometimes people also just need to be heard. But all I need to know is, what are you experiencing? And then I need to ask myself, is this pathological or not? And then you can treat. So it creates a nice space where I don't have to, working within the scope of my practice, I'm not there to sit and counsel the patient for half an hour. That's not my job, and that's not what I'm trained to do. I'm here to hear, what are they experiencing, and then make some judgments about whether or not that's something that needs an intervention. That make sense?
A question about that? Like,
sure.
The same thing. So you treat, depending on what you're seeing as the emotion, and is that enough in itself, or do you need to go, like, does the person need to also do the therapy or something further? Like, how do you
Depends. So very often the easy way to answer that is, how much does it change over a couple weeks? How long has it been there, and how quickly does it change? So someone who, sees a car accident and is just kind of shook up, like, most of the time, they're not going to have to go to an extended therapeutic relationship with that. Things like cognitive behavioral therapy can be helpful if they end up having some sort of aversion to it longer term. But often for us, it's like, okay, how do we just get you out of being stuck in this? Because this is just a movement of qi that's in their system. If we can just help that movement of qi reintegrate, then that's the end of the story. For other people, especially things that happen in long time ago or in early childhood, or deeply ingrained, or become things that the person's attached to through their belief system, then that's when I'd want to refer them out to a psychotherapist and work in tandem with them. So it's a question of length of time, severity, and stickiness of the emotional issue. For me, that's how I think about it. and I think the two go well together. I'm going to mention a book towards the end of the class today called Dragon Rises, Redbird Flies, which is there's the Dragon Rises school in Florida, which is based off of the author of this book. And he started out as a Western psychotherapist and then became an acupuncturist. One of the things he comments on is that the speed at which you build a therapeutic relationship when doing acupuncture is faster than basically any other modality. So oftentimes he's having conversations with his patients as an acupuncturist and psychotherapist that would take 6 months of rapport building to get to in purely psychotherapy. Because it turns out if someone trusts you to put needles in them and leave them alone in a dark room, telling you about like scary things that have happened to them is not such a big deal. I mean, that's my half joking way of saying it, but there's a lot of trust that has to go into the acupuncture therapeutic relationship. And so it creates rapport very quickly, which is helpful. That makes sense, Melissa?
Yeah, and just from my own experience, like it's been about 4 years of being treated with acupuncture, and I just know that like there was emotions that came out like unexpectedly and I wondered like how they were going to get resolved like without talking it. I had to use all different methods though.
Sure. Yeah, and that's normal. Like different people having different responses to these things we should expect that because we're in the medicine of everybody's an individual. One of the things that especially for patients who have stuck emotions from things in the past that are no longer going on, who have gone to therapy for a long time, often they have emotional releases when getting treated with no content. They're like, wow, I'm just suddenly very angry, but I don't have an angry at. There's no story. I'm just having a pure experience of anger, or I'm crying, but it's not about anything. It's like, yeah, we're just getting this energetic pattern out of your body. We're getting this movement of chi to let go. And then on the other side, things are different. And there doesn't have to be a why. And there are other people where there has to be a lot of why because the way in which they understand themselves and the world has to change to some degree. That makes sense? Okay. Molly asks in the chat, how often do you get patients that are afraid of needles or very anxious for their first acupuncture treatment? I've treated a lot of patients and a lot of them got their first acupuncture treatment from me. I use the ideas of these movements of chi to make it easy. So if the patient is very reserved and very quiet, which I've treated in places where the general culture is quite stoic, so they're afraid, but they're, every time the needle goes in and they get chi, they kind of shrink up, and you can tell that they're fighting what's happening out of fear. Like, okay, well, I want to get these patients to laugh. I want the energy to move. So you engage in behaviors that do that. With other patients, they're, shouting and, or very loud about what's going on as their way of expressing their anxiety or their fear. It's like, okay, for those people, then, well, I kind of want them to laugh too. I usually find turning it into a joke and a game works really well for people. I mean, keeping your professionalism and your seriousness, not turning into a clown, but lightening the mood, because, well, people who are anxious and fearful, all of their chi is moving down. We want to rise their chi upwards because we actually want them to experience the needles. Like we want them to have the experience of the thing they're afraid of in that setting, but they have to not be afraid, and we just raise their chi. Yeah, I don't find it to be an issue.
I have a question, Peter.
Sure.
And this is like not really relevant right now. We can skip it.
Okay, we'll see. Mm-hmm.
Okay, crying. I've cried a couple times while getting acupuncture, but it's always kind of like a peaceful, teary moment. Is crying always considered like the same type of movement of chi? Are there different kinds, sobbing versus what I just described?
Mm-hmm. Yeah, I mean, so crying isn't seen as particularly special within Chinese medicine, and it's largely uncoupled from emotions. I mean, people cry for also, like we associate crying with sadness culturally, but people cry from beautiful things. People cry from joy. People cry from seeing loved ones. People laugh at funerals. Like the actual act of what's being expressed isn't necessarily paired with the emotion that's underneath. And what I find in general is that crying is usually one of the best ways to let go of long held patterns. There's often a saying goodbye to something internally that comes with crying. There is a letting go that comes with it, but that can be a joyful letting go for a lot of people. It doesn't have to be a painful experience. And when people have that experience of like that very peaceful, like completely relaxed and just tears gently streaming out of the eyes sort of experience, that can be deeply healing for people. And it's, you know, being pinned to a table is a good way to keep a person from being racked with sobs and letting them actually relax into it. One of the places this is most common is for people who are consistently in a fight or flight state, who are always amped up and always like threat sensing. The first time they relax, just that release of tension often results in crying, laughing, hiccups, giggling. I've had patients laugh for half an hour straight on the table. Like, and they're like, I don't know why. It's like, it's repressed joy. It's getting out. That's great. Hopefully you'll have more access to this on the other side. Yeah, good question. Yeah, and this next part of the lecture should make some of this emotional stuff a little bit clearer, because we're going to try to define these emotions. One of the issues when talking about emotions is I say anger, and my idea of what anger is aside from the Chinese medicine stuff, my idea of anger is built upon my experiences of anger or my lack of experiences with anger. And yeah, so Alexa says in the chat, she laughs when she's in pain. It's like, that's super common. People laugh, people shy away, people have all these different ways of interacting, of expressing different emotions that aren't necessarily tied together in a way that makes instant clear sense. So we're going to try to break this down to just movements of chi for the emotions, so that when I say anger and you hear anger, we can both go, okay, yeah, are we both talking about a rising and outward expanding movement of chi? Or is one of us talking about repressed anger, which would be a different movement of chi? But in normal parlance, I might say anger and mean outward expansion, and the other person might say anger and mean inward contraction, because their entire experience of anger is about repression of anger, and my experience is about expression. So we're trying to disambiguate this so that we make sure that we're talking about the same things when we talk about emotions, which is hard. You guys with me on that? That's a somewhat large concept. Let me know if that's an issue. Okay, because that's what's coming next. Maggie, can wind be created internally from emotion, or is it purely external? It can absolutely be created internally from emotion. The idea of a person, the kind of cinema trope, TV trope of a person who's a large, red-faced person who gets so angry that they have a stroke, that would be an example of wind rising up from anger irritating the liver. And within Western medicine, that's just high blood pressure causing a capillary to burst in the head. In Chinese medicine, it's the qi moving all this energy upwards, causing wind, causing improper movement of qi within the vessels, causing a vessel to burst in the head. So I see those as pretty mutually compatible despite being different descriptions. Okay, good questions. I'm gonna dive back into this lecture here and keep them coming. We'll spend another 10 minutes on questions after the next break. Okay, so some errors in Macchioccia, back to this. A very important feature of Chinese medicine is the state of the internal organs affects our emotional state. For example, if liver yin is deficient, perhaps from dietary factors, and causes liver yang to rise, this may cause a person to become irritable all the time. This totally happens. This is very common, that through diet, people lack the yin substance they need, and so they become unrooted. They get like often a little bit like very mild vertigo or dizziness, ringing in the ears, and just get irritable. We often call this being hangry if we're talking about someone in a day-to-day sense, but on a longer term sense, this can be a consistent experience for people regardless of what they've eaten that day. But Macchioccia's made an error here, which is that liver yang rising doesn't cause a person to be irritable all the time. Liver yang rising, if it's experienced by the pericardium and the heart, is irritability. They're the same thing. It's not a cause and effect relationship. This is going to be something that you're going to return to again and again in Chinese medicine. Within the Western philosophical tradition, A causes B, causes C, causes D. And often within the Chinese medical way of thinking, A, B, C, and D are all manifestations of the same thing. And we want to go treat that thing. So as opposed to going over to A and treating A to get rid of B, C, and D, we want to find Q, X that's underneath A, B, C, and D and treat that. And we figure out what that is through the manifestations. So when reading Maciocia, this error, this cause and effect error, is through his entire text. So this seems to be a central misunderstanding of the concept that Maciocia had. This is not to denigrate Maciocia. His ideas and his writing in English preceded this understanding, and he's now passed away, and I'm grateful for the work he did. We've just gotten better at this since then. It's not that Chinese medicine has changed, it's that our understanding of Chinese medicine in English has changed. So for your board exams and for all the exams in this class, you need to know these things. Anger makes the qi rise. Joy slows qi down. The phrase that's often used that I really like is joy slackens the qi. Sadness dissolves qi. So someone with sadness long-term will often become qi deficient. Worry knots the qi. You'll often hear people who are worrying about something feel like, I just feel like I have a knot in my stomach. In Chinese medicine, we go, you do. It's just in your qi. Pensiveness also knots the qi. So worrying about something and thinking about something too much, even if it's not worry, will both knot the qi. Fear makes the qi descend. This is why, we'll get to that in a minute. And shock scatters the qi. And emotions affect the heart. This is what you need to know for all of your official exams. But in reality, qi rising is anger. Qi slowing down is joy. Qi rising, anger isn't caused by qi rising. Qi rising is anger. When qi is dissolving, the experience of qi dissolving is what we call sadness. When qi knots in the abdomen, that's what we call worry. It's not cause and effect, it's simultaneous. So all the same movements, all the same things happening, but it's not A causes B, it's these things are the same. The thing that makes it an emotion is whether or not they affect, whether or not they're felt by the heart and the pericardium. So qi rising that the pericardium and heart don't feel could be red face, high blood pressure, tinnitus, dizziness, vertigo. If the pericardium and heart are involved, then it's also going to involve anger. This makes sense? Yes.
So when you're describing this, the thing that comes to mind is like, I mean, like specifically with like the fear and shock emotions, you know how sometimes like when you first like experience like fear in a situation or shock or something and you get like the tingles in your body and it just kind of like happens, is that sort of a manifestation of what the qi feels like, and like the knot in your stomach with worry is like where you feel that?
Yes. So if you read fiction regularly, the descriptions of emotions match these movements of qi. Like when the person's suddenly surprised by something scary and their stomach falls down, like they get a pit in their stomach. The person who sees an injustice happen and they feel their energy rise up in them. It's like, yeah, that's anger. The person who's lying on a beach and finally relaxes and it feels like they're just getting carried away by the waves and time slows down. It's like, yeah, that's right. The person who's crying and feels like not only are they losing the person who's passed away, but they're losing a part of themselves. Yes, that's the qi dissolving. Yes. So while this way of thinking is perhaps somewhat odd in relation to the way we talk about these things within a Western context, this is actually often the language we use to describe emotions in a day-to-day sense. And it should match up with your subjective experience. The tingling, but also this like when you experience anger, if you're going to express it, it feels like a rising upwards. That people talking about seeing red, that's just chi moving up to the eyes. Good question. It's really hard to get out of the cause and effect model in your own head. And if a part of you is going, this doesn't feel particularly logical, I don't really want to think this way, just try it on a little bit and see how it goes. Part of the issue here is that for cause and effect to happen, there has to be time, right? A has to happen, then B has to happen because of A. But if the two things happen simultaneously every time one or the other one happens, we're just going to call them the same thing in Chinese medicine. So when your chi rises, you don't then get angry. When the chi rises and affects the heart, that's anger. Like, it's not that something surprising happens and the pit falls out of your stomach, and then a minute later you get afraid. It's that falling sensation is the fear. So why does this all matter? If emotions are just movements of chi, then we can resolve them through movements of chi. So if fear is just chi moving downwards, all we have to do is to get the patient's chi to stop moving downwards, and they won't be afraid. I mean, easier said than done. But often we think of emotions as this thing that exists in this other bubble, that this subjective bubble that we can't really work with within a Western medical model. You go to a psychotherapist, you talk for a long time, and hopefully it works well, and it often does. But within Chinese medicine, we go, anger is just too much up and too much out. So if there's less up and less out, then it gets reduced, and that's that. And while that seems flippant, it also works, which is pretty cool. Why do we care so much about emotions? I've talked to all of you on our first day about what it is you're coming here for, like what it is you're looking to get out of the program. And a couple of you mentioned emotional things, but a lot of people are here for more of the orthopedic stuff. People are here for women's health, allergies, pain, addiction. Like, there's a lot of things here, and emotions are often not what people come to acupuncture school for. But if you're treating patients for any of those things and you think emotions aren't going to be a part of it, then you haven't spent a lot of time with patients yet, which could be totally appropriate for where you're at. If you're working with chronic pain and you're not working with emotions, you're going to have a hard time getting to serious resolution of that. If you're working with addiction and you're not working with emotions, you're going to have a hard time. Women's health and emotions, there's a lot of connections there. No matter what you're working with, emotions are going to show up. So just like knowing how to treat pain, you have to have some ability to work with emotions. What often happens is that people who don't really have a way of thinking about emotions and go into Chinese medicine just focus on getting everyone basically high from the acupuncture, and kind of are like, look, if you're happy and you're blissed out, then we don't have to worry about the emotions. But that tends to last a day or two, and then the person just gets addicted to acupuncture, which is like not the worst thing to be addicted to, right? Generally beneficial. But we can do better than just getting people happy every week. We can get them to not be afraid of things they shouldn't be afraid of. So we see this as a massive cause of disease. In fact, some people argue that emotions are the main cause of disease internally. This doesn't mean that that a person's long-standing unprocessed anger is going to result in them making bad decisions, though it may. This means that their long-standing anger can be the thing that turns into high blood pressure and a stroke. That one's fairly easy. That's fairly accessible in terms of thinking about it. It also means that their long-standing anger that they're not expressing can turn into irritable bowel syndrome, or chronic fatigue, or cancer. We've got models for how all of this works. For now, you're going to have to take my word on that a little bit. You're going to not have to take my word in another few semesters when you start learning about how that works. But for now, just play with the idea that long-standing anger can end up being the thing that causes a person to die from something that seems unrelated within a Western medical model. Outside of being, sure, let me just finish this slide, because there's one more piece to this, and then I'd love your question. In addition to being a major cause of disease in Chinese medicine, they're also the main quality of life factor for patients. So a patient with chronic pain who's sad about their chronic pain is going to have a much harder time going through the world and living their life than a person with chronic pain who's not sad, or who's only sometimes sad about their chronic pain. These emotions can often be the issue that ends up being crippling with chronic disease. One of the phrases that comes from Buddhism about this is that there will be pain in your life, but the suffering is somewhat optional, and the suffering comes from the emotion side of things. So if we help to relieve some of these long-standing emotions that people have, they may still be in pain. We may not be able to do anything about that, but they may stop suffering and they may be able to go about their life in a fairly functional and normal way. Yeah, what was the question?
Hi, sure. I was gonna ask, would it be appropriate to say that emotions are sort of a physiological, I mean, that I guess this is Westernization, that's like that term maybe, but like it's a physiological event, experiencing an emotion, it like is triggered and then the whole body kind of is doing something while you're experiencing the emotion?
Yeah.
Okay.
I would tweak that yes, and it's a little closer to the physiological event is the emotion. So it's not that fear causes maybe tingling on the back of your legs and a feeling of falling. It's that feeling and that tingling are fear. We've interpreted them and we've learned to say, oh, I'm experiencing fear. But one of the interesting things is that the more people spend time meditating, the more they start to notice that like, oh, these terms we have for an experience are actually made up of many sub-experiences, many smaller experiences. And if you change those smaller experiences, the larger one does too. So if the person encounters a situation they would be afraid in, and they don't have that falling experience, then often they're not going to be afraid unless they're really attached to their fear, in which case they will cause their chi to fall themselves.
Are they attached to their fear and to the emotional reaction, or to a thought that triggers the emotional I'm just like thinking of it as being almost like it is a functioning, it's a triggered functioning in the body that affects certain organs, and it ultimately could lead to a pattern of disharmony. I don't know. I'm not really sure what I'm asking. I'm just clarifying, I guess.
Yeah, well, I'll just spend one more second on this then. Yeah, so people get attached to all sorts of things. So there's an idea in Chinese medicine, important to know, where your intention goes, your chi follows. Where your thoughts go, your chi follows that. So one of the things I'll have patients do who, for instance, have issues with chi rising up at night that keep them from sleeping, I'll tell them to soak their feet in hot water for half an hour before going to bed while paying attention to the sensations in their feet. It's the easiest, most straightforward way to get a person's intention to lead their chi downwards to their feet so that they can sleep. Someone who feels completely scattered, I might have them put their hands over their abdomen, like over their belly button during a treatment, and have them focus on the feelings in their palms or the feeling in their abdomen so that that earth gets built up. What people expect to happen, they often create. So if a patient knows they're afraid of dogs and they have the exact same situation happen every day while waiting for a bus where a dog barks at them and they get afraid, if we're treating them for that fear, I did this in Guatemala, which is what I'm thinking of here. If we're treating them for that fear because it's not a rational fear, because the dog, but they were bitten as a kid, then we need them to try not being afraid as well. If they're working themselves up into fear long before they get to the bus stop, then they have conscious control over this. They can override anything we're trying to do. So we need them to approach the situation with some degree of equanimity as well. If they're expecting the fear, which would be another way of saying attached to the fear, then that's going to happen. We can't stop that. But if we can get them to let go of the attachment to it, which we can do through acupuncture, then it's not really an issue.
Thank you.
Yep. Thanks for the question.
So is that like breaking the, maybe I shouldn't, this is like Western maybe, I don't know, but like the feedback loop, like a positive feedback loop? Is that?
So in Chinese medicine, this is usually some sort of qi or blood stagnation. or some interaction between the organs. If a person's holding onto a pattern and not letting go of it, our question in Chinese medicine is why? What is it that they're getting from it? So for example, if someone gets fearful very easily, are they getting fearful because they don't have the reserves built up to be confident that they can deal with it? So often people who are very qi and blood deficient get nervous and fearful because because their body is not going to be able to handle difficult situations. If they become less deficient, then they'll be more able to handle chaos when it comes, and they don't have to plan about it and be afraid of it all the time. So it depends on the person and the situation how we go about changing those feedback loops, but we don't want to change a feedback loop if it's there for a good reason. And oftentimes it is. And if it's there for a good reason, we usually can't anyways. That makes some sense? Okay. So the last piece of this, frankly, introduction to emotions, before we go into a little bit of a deeper dive, is that within the Western medical model, we don't really have a theory of emotions. It's far too subjective. Oh, Tamar, what were you referring to when you said that's a function of stagnation, right? Sorry, I sometimes miss the chat.
Oh, I meant when you said that like pent-up emotions kind of are directly in Chinese medicine related to disease.
Yep.
And so when you're talking about like the flow of qi, then if it's not smoothly flowing, then that's stagnation. And then
Yes.
we learned that stagnation is basically like turns into heat, and then that is like disease and stuff.
Yes. So yeah, that's a bit of the mechanism. It's like, okay, how do emotions create disease? Well, emotions can lead to excess, deficiency, or stagnation. And then that is just off to the races. We know how that works from there. But there's nothing special about emotions and how they do that. They're similar to stubbing your toe. We just have a lot more built up around it. Yeah, good comment. Okay, so part of the issue is that within the Western medical model, there isn't really a theory of emotions, so it's hard to talk about. Anytime you don't have a theoretical basis for something, you tend to have to only treat the branch. So we have germ theory. We can use antibiotics to treat bacterial infections. We understand how that whole process works. We don't really have a theory of emotions, which means when a person comes in, we're limited to a handful of interventions, either the relatively objective side, which is more or less excitation or sedation. And then we have the subjective side within Western medicine, which is psychotherapy, cognitive behavioral therapy, a whole branch of relatively new types of talk or interactive therapy, including MDMA therapy and other psychoactive compounds being involved in a therapeutic setting. But ultimately, all of that is some of those things may resolve the root, but it's hard to tell because you're relying on the person's self-reporting and their own self-diagnosis of this. We have some extra tools because we can use things like the pulse and the tongue and see how those change over time. It's a little bit early for the second break, but I'm going to take a second break here because we're about to do a deeper dive into the emotions one by one, and we'll see how far we get today. But that was a lot. I hope everyone's digesting that fairly well. And you have 10 minutes. I will see you at 11:05, and I will be here for questions in the interim. Thanks, Camilo, for helping out. I think we're doing okay, but yeah, let me know if there's any issues you're seeing. Okay, welcome back. Let's go right into the emotions. Check in really quick. Any questions pop up for anybody over the break there? Doing okay? All right. So let's go into the emotions. So the first thing we got to do is define emotions, right? This is the part that within a Western context is hard to do because we don't have a framework in which to do these definitions. So the problem is that people have experiences and then they give them different names. So very often what I experience, let's say, as heartburn, someone else might experience as anxiety. What I experience as depression, someone else might experience as anxiety. These words are a little fuzzy and their boundaries overlap a bit. 1 second before a cat knocks something off of the counter. So emotions have fuzzy definitions, but movements of chi don't. And so what we're going to do here is just go through these emotions, go a little bit further into what the movements of chi are, when these emotions show up, and yeah, give a little context for how to think about these things going forward in your clinical career. So what we're talking about here, it's just yin and yang and a little bit of Buddhism, a little bit of Taoism. So anger, and these are definitional statements for each of these things, all right? Anger is the emotion experienced when a person believes their destiny, whatever their destiny is in that moment, is going to be aided by an action, activity, or event, but they're being blocked by an obstacle that can be removed. So it's a little bit wordy. But what that basically comes down to is something's in my way. That's the central requirement for anger. There has to be something in the way. This is, on an energetic level, in a positive way, the same energy that's being used by the root of a tree when it breaks through concrete in a city. This is where change comes from. And this wood emotion is change. The anger only shows up when there's an exterior thing in the way. It doesn't have to be, this doesn't have to be true. So whether or not someone's angry isn't determined by whether or not their perception of reality is correct. All that matters is that they're experiencing a certain set of things. If the person doesn't perceive what they're experiencing to be anger, but they describe it to you, and they're, I don't know, I get this feeling like this upward rushing sensation anytime people are in my way, and they don't name it anger, that's always easier for us because they're going to be less invested in whatever it is. The easiest example I can think of for anger is being somewhat late for an appointment and going up the subway steps and someone moving very slowly in front of you. You're not necessarily mad at the person. It's not really a problem with them. But that sensation side of like, you're in the way, there's this external thing that is in the way of me getting to what I need to do to move forward in whatever way I perceive that. A couple of things to point out there. The idea of moving forward itself is a wood idea. The idea of getting to a thing is largely a wood idea, moving towards it, growing. These are all wood ideas. So anger itself exists in relation to a bunch of other wood concepts. This is just the first pass on each of these emotions, and we're going to come back around. I'm just starting with definitional ideas. So if we were to diagram this just a little bit. No, we don't spend that much time on this. That's anger. Joy is the emotion experienced when a person perceives that everything has come together in a beautiful or transcendent moment of celebration. So this can be a music festival. It can also be an Irish wake. Like, this doesn't have to be about a thing that's good, but it's people coming together in a way that's somewhat transcendent and celebratory. It can be about something sad. Funerals can be joyful in a way. despite them being about a thing that you might not be happy has happened. So the second part of joy is that no matter how joy is experienced, it's always followed by some sort of a come down, which can be painful. So joy itself represents a sort of high. Now that high can come completely naturally, from graduation to the birth of a child to a wedding. But afterwards, I mean, some of you have experienced this in other programs. Oftentimes the day after graduation is a rough day. It's like culmination of a thing, and now what am I doing next? The wind falls out of the sails a little bit. Completely normal, because that's one of the consequences of joy. So patients who are consistently wanting to stay in a joyful state are often saying, like, I really like being at the top of my emotional experience, but I don't want to go through the roller coaster that returns me to it. I just want to artificially stay there. And the artificial ones are pretty obvious. Things like cocaine and MDMA give that feeling of that transcendent coming together celebration, but it's often not based in reality. So in reflection afterwards on the experiences had using those substances, there may be a memory of it being beautiful and joyful, but at the same time, often nothing actually happens. It's an artificial sort of joy that saps our ability to actually be in that phase. And then that makes the come down more painful. So anger, moving towards something, joy, arriving, transcendent celebration that you're there. And then sadness is when a person perceives a previous state of being, often a joyful state of being, which they were attached to or identified with, is gone and never coming back. So again, like after graduation, you might have that feeling of like, oh my God, I loved being a student so much and I don't get to go back to school. Some of you may not feel that. This is easy to think of with, say, the death of a partner, like, or a divorce, where it's like, look, you know, even if I want this divorce, at the same time, that thing that was, I know it can never happen again. Perhaps the person and the partner can come back together, but it won't be the same connection that it was before. It'll be something new. The new thing might even be better, but the thing that was is gone. So this is the moment after joy. When we say the come down from joy, the come down is into sadness of realizing that that peak is not going to be reattained. And often this feels kind of timeless when you're in it, this feeling of like, this is an actual baseline. And people often run away from this feeling because there is a finality to letting go of things that have happened in the past. And the sadness then leads into fear, which is, okay, we've left this experience behind, I've let it go, so I've processed the sadness, I've moved through the sadness, I'm no longer attached to the past. And now, where am I? What's next? So often after graduation, you go into sadness, and then from sadness, it's like, oh my God, I've got to build up an entire new life now. Like I was identified as a student, or I was identified as a husband or a wife or a parent, and now that's gone, and who am I? What am I? What's my purpose? Why do I get up in the morning? And that's fear at its most essential. Fear is the emotion experience when a person encounters the true unknown. When you're in an ocean with no visibility and something swims past your leg and you don't know what it was, and you get the when you're in an apartment alone and you hear a sound that shouldn't be there, when you wake up in the morning and you're coughing and blood comes up, it's this feeling of suddenly the ordered world that I knew has revealed itself to be disordered. The chaos is there and I didn't see it coming and I don't know what to do with it. For people who are interested in more about this, this is the emotion that H.P. Lovecraft tapped into in his writing. This idea of the fear of the unknown in its purest form. This can be an existential crisis for people. So this can be the like, cool, I was student, wife, husband, lawyer, whatever, followed by, I don't know who I am. I don't know what matters. I don't know how to orient myself in the world. Like I would like to, get back to that wood towards and building things that matter, but I don't know what matters. I don't know how to be a good lawyer because I'm not a lawyer anymore. So I want to be good, but in what way? So we do a lot to avoid this emotion. This feeling of like, I don't know who I am. I don't know where I am. Nothing makes sense. in the void. We do a lot to avoid this. Your patients do a lot to avoid this. And oftentimes patients who come, I've had quite a few patients who come to me with chronic fatigue after a sudden event that really shook up their lives, who get stuck in this fear place. A lot of addiction arises here because this is not an emotion people want to experience. And two more emotions to cover. Shock is a little bit different. So fear is this bigger fear of the unknown type of fear, and shock is discord suddenly happening. So shock is the emotion experienced when a person perceives something so discordant with their expectations of reality that they can't process it. So very small version, it's you taking a nap, you're settled into the comfortable silence, and suddenly a car backfires near you and it shocks your system. And you have that, it doesn't just wake you up, but you can't relax back immediately. Your pulse rate jumps, you might feel your heart pumping, you might feel your pulse in your throat, that like you're suddenly breathing a little bit quickly, it's that sudden agitation. In a medium form, this is the feeling you get when you're on a subway train and someone has a mental breakdown in the same car that you're in. Or someone suddenly starts yelling about something and you don't know what's going on, completely thrown off by this. There's some connection between fear and shock. These are both related to water, but there's a little bit of a difference. Fear is downwards, shock is kind of blasted apart. And in the extreme form of shock, it's physical assault. It's either being the victim of, being the perpetrator of, or witnessing things like physical violence. So this is often where things like PTSD begin to come in. It's where the shock to the system is so great that bringing the pieces back together becomes challenging. People who are shocked enough often look like they're heavily sedated. They kind of go into a mildly catatonic state, and that's because of the scattering of the chi that they've received. So we try to bring their chi back together to get them out of that shocked state. We have excellent herbs for doing this in acute situations. Shock is also usually accompanied by other emotions. While I was an acupuncture student, I did a bunch of herbal training before I ever went to acupuncture school. I had some tools under my belt before I started. And we've got an herbal formula called Yun and Bayao. Great herbal formula. It's used all the time by vets in the US, but we don't really use it in Western sense on humans. We do in an Eastern sense. The wonderful herb, it's used to stop bleeding without causing blood stagnation. So it simultaneously kind of works as a blood thinner and something that hyperpotentiates clotting. In low doses, we use it to stop shock. I was over at a friend's house while I was in acupuncture school and had a whole herb kit with me and all this stuff. And I was treating a friend of hers, and she is a sponsor in AA. And she got a phone call that a woman that she was sponsoring, her sponsee, had hung herself. Instantly goes into shock from this. I've got these herbs with me. Like, here, look, take these. She takes them. Half an hour later, exhausted, falls asleep, wakes up like 12 hours later. I've left by this time. Wakes up like 12 hours later. We talk on the phone pretty much right after she's woken up, and she's like, I still feel completely traumatized and exhausted and sad, but I'm going to be the person who's in charge of setting up the funeral and doing all these things. And this is kind of amazing. I feel like I can actually move forward and do stuff. I'm not paralyzed by this. Like, it's traumatic, but it's traumatic in a way that can be worked with. And that's what getting people out of shock does. As long as you're in shock, it's very hard to figure out where to go next and what to do. You get people out of shock, and they're usually going into another emotion, like sadness or anger, which can be worked with much more easily.
Peter?
Yeah.
So when you say they went into shock, are you talking about, because there's like a Western medical definition of symptoms of shock?
Not that.
And so not the same thing, right?
Yeah, not the same thing. Can be. I mean, if emotional shock is bad enough, people start hyperventilating and their lips can turn blue and they can pass out. But this is more of like, so it scatters the chi. That's what's happening to their, on an energetic level. But on a behavioral level, this is usually a breakdown of ability to really rationally communicate well, a complete scattering of thoughts. So 1 second it might be like, oh my God, like using this, just going with this example, 1 second it might be, oh my God, I can't believe my friend has passed away. And literally 1 second later, it might be, what are we going to do with our cat? And then the next second, it's who's going to contact the family. And then the next second is, I'm really worried, I need to go to a meeting myself. But none of these things can be acted on, processed, or worked with in any way that's beneficial. So it's this chaotic scattering of all of the energy that doesn't result in anything positive, and from a Chinese medicine perspective, causes more damage. So we want to try to help people to get out of that situation. Sometimes people get stuck in it chronically. We often call that PTSD or other sorts of trauma, where they're stuck in a hyper agitated situation and it damages their cognitive abilities and processing abilities. Whether or not this is physiological shock is not particularly important, but it's usually not, especially on minor levels. This makes sense to people? I'm seeing lots of note taking, so that's a good sign. All right. Let's go into rumination. So rumination is the emotion experienced when a person perceives a situation in which a wrong decision will have such negative consequences that they're unable to make a decision at all. This can also be someone's made a decision, but they keep thinking about it anyways. So rumination could be, you've decided to move into a new apartment, and after you move in, you're still wondering if you should have gotten the other one, despite the fact that you can't go back and change that. Like, that's over, but that attachment to these decisions stays. So a highly risk-averse person having to choose between two risky options would be an example here. The movie, the not very good Ben Stiller movie, Along Came Polly, is an example of someone who ruminates excessively. This character, who's a claims risk analyst professionally, trying to choose what he should do in his life and being unable to make decisions because all he can see is risk. When we say that a wrong decision will have negative consequences, what we're saying is that, all of us know that with our decisions, there might come negative consequences, and we try to make our best decisions to make as few negative consequences as we can. In this case, the person confident of something, a person with very few resources, who is very deficient, might be confronted with a decision that to you or I would be fairly easy. And even if you're wrong, does it really matter? And to them, they might be in a situation where I have nothing left. Like, if I lose anything at this point, this could be a really big problem for me. And therefore, I'm crippled by indecision, because if I make the wrong decision, I'm not confident that I'm going to be okay. That may or not be real, but they perceive it that way. We work with this just with everything else, with acupuncture. So each of these statements start with a person perceives. So emotions are all about perception. The heart and the pericardium, their involvement is about the perception of reality, not about the reality. So when patients say things, they're about what they're perceiving. Whether or not it's factual doesn't really matter, because they're giving you a window into what they believe about the world. So if you have a patient who comes in who's super anti-vaccine, for example, they're telling you a lot about how they perceive the world in that statement. The fact that they're pro or anti-vaccine is not wildly important to me as a practitioner. I have my own views. They're irrelevant to this class. But if a person comes in and has that perspective, they're telling you a lot about what they do with the world, how they interact with it. So we get given a lot of religious beliefs and political beliefs and cultural beliefs, but on top of that, we develop other beliefs. And when your patients talk about their emotions and they talk about what they perceive in the world, they're telling you what they're focusing on, where their attention is. If everything your patient tells you is them annoyed or irritated or pissed off by something, they're telling you that they're angry, even if they can't use that word for it. So if your patient comes in, so how are you doing this week? Oh, I got cut off on the way here. People are just so inconsiderate. I try to get places on time and everyone just stops me. It's like, well, how do you feel about that? Oh, I feel fine. They just described anger. The fact that they can't name it anger doesn't matter. They're describing the movement of chi outwards, their attempt to get to where they want to go being blocked by outside forces. That's our definition. The fact that they can't then also name it anger could easily come from the fact that when they were a kid, they were told that, I don't know, ladies don't get angry. It can be as simple as that. So often as their perceptions about the world change, their emotions will as well. So sometimes someone who's consistently angry, who's coming in to see you, it's less about getting rid of the anger and more about opening up the flow into the other emotions, for example. Sometimes this means their worldview or belief systems actually have to change. We don't counsel them for that, but oftentimes you'll hear patients say these things. So a patient who comes in who's like, I'm just always depressed. Like, I've always been depressed. I'm always going to be depressed. I'm depressed today. I was depressed yesterday. And I know for a fact that I'll be depressed tomorrow. If 3 or 4 treatments later, they're like, yeah, I've been kind of depressed, but I don't know, like, I think I might get better. That's progress. They're shifting their way in which they actually view the world. And if their perception changes, then these emotions can begin to shift as well. This makes sense? Okay. So when we talk about, I'm gonna have to use my makeshift whiteboard here. When a patient comes in and they say to you something like, I don't want to be angry, I just want to be happy all the time. What they're saying is, yang on top, yin on the bottom. This is done over time. Fire on top, metal moving downwards. This is directional, of course. Water at the bottom, wood moving upwards. And they say to you, I just want to be happy all of the time. What they're saying, in part, is the only part of the totality of experiences that I'm comfortable with are the ones that are in the fire element, in the fire phase. Everything else I'm uncomfortable with. So down here with water being at fear, that tends to be the one that's the hardest for people who just want to be joyful all the time. And part of the education that we can give and work with patients is saying to them, having all of the experiences enriches all of them. So your ability to be joyful is relative to your ability to be sad and fearful and angry. And you'll have your own personal makeup, and some people get more joy in their life and some people get more fear in their life when they're healthy and happy. But you need to have all of these things or else you get stuck in one place and everything else begins to feel like dissent. Same thing for people who are angry all the time. Like, look, yeah, I'm angry all the time, but so what? I get things done. That sort of perspective. They're often telling you, I'm not comfortable in any of these other states of being. They're saying that emotionally, but we expect that to translate into other aspects of their life, from their diet to their exercise, to the way they form relationships, all across the board. So, yeah. So in this cycle, Earth is the transitions. So that's going to be each of these lines. That's Earth right there. So's that. So's that. Anyone who's in New York who's been feeling under the weather the past week or two, the likelihood of you having an Earth-related issue is fairly high because we're in the transition between summer and fall, and Earth makes up all the transitions. You remember the, need to find a pen that isn't leaking ink all over my hands. In the Celestial Cross organization, like this, we have the 4 seasons, and in between we return to Earth. So oftentimes if someone's stuck in one emotion, we have to ask, so the person who wants to be joyful all the time, is it a joy-related issue, or is it that they got stuck here and they're just real bad at transitions? That would be an example. Okay. So oftentimes when a person identifies with an emotion, and they're holding on to that, they're telling you which element, which phase that they either have a problem with due to attachment, due to excess, due to deficiency. You got to figure out all those things and working with the patient, but they're telling you where their problem is. Even if all they can say to you is, you know, your elevator is really slow, and your doorman, he's kind of rude, and the front door, it only opens on the left side, and you know, that's you should probably take care of those things. And you go, oh, okay, well, do you run into these things in other places? Oh yeah, the people I work with, they can't do anything right. They're always getting in my way. Anytime someone tells you someone's getting in their way, they're telling you they're angry. And then you get to the part, so how have you been feeling emotionally? I'm happy all the time. Well, you just spent 10 minutes telling me you're angry, but that doesn't necessarily relate to their perception of themselves, just the perception of the outside world. So one of the central ideas we have is you can't have happiness without sadness. It doesn't work. You can't have joy without fear, without sadness, without thinking. So when a patient's stuck in one of these places, if we don't open them up to more of these experiences, then they're telling us where their chi is stuck, and that's giving us a window into how disease is going to develop over time in a more serious way. It's also telling us that they're probably going to have issues in their relationships with friends, with partners, because you kind of need to engage with all of these emotions to have a full relationship. So quality of life issues, let's say. So each of these movements of chi, anger moving outwards, or causing chi to rise, or anger as chi rising, joy slackening the chi, sadness dissolving the chi, all of these movements of chi result in predictable changes, predictable pathology. Knowing what these are helps us untangle what our patients tell us. So a patient who loses a partner, loses a husband of 10 years, and develops a cough, that's telling us about their lungs. Well, yeah, we have lungs and grief connected, but we know that the sadness is going to be dissolving that lung chi. That's what it's going to be doing. And again, if a patient says, I'm very fearful about things, but as they describe the fear, what it sounds like is overthinking an issue, then it doesn't matter what they call it. We can see, okay, sure, they call this movement of chi where they're ruminating on things fear, but I don't have to correct them. It doesn't matter what we call it. What matters is what the experience is. And people have different terms for the same experiences. So you have to do some translation work to figure out, you're not renaming their fear as anger, but you're saying, okay, you call this movement of chi that I call anger fear. That's fine. It doesn't really matter what you call it. We're working with the movement of chi. The fact that I'm calling it anger is somewhat arbitrary too. It doesn't matter. What really matters is the movement of chi that we're naming. That make sense? Okay. Sure, nothing in the chat. Yep, nothing in the chat. Okay, let's get into, so we're gonna do one more pass on all of these emotions. So sum up here, anger is a rising of chi, specifically liver chi, tends to be liver chi. And it's usually due to excess, stagnation, yin deficiency, or heat. The symptoms tend to manifest in an excess looking manner in the head or neck. Because anger causes the chi to rise, we expect to see symptoms up at the top of their body. If this lasts longer term, or if it's due to yin deficiency, you tend to also see problems at their feet. Because this rising of chi fills up the top, we see excess symptoms here: red face, tinnitus, tight shoulders, trouble sleeping. And if they're also deficient underneath that, then we see cold feet, or decreased sensation in the feet, or tendency to stub their feet and stub their toes and run into stuff because there's no chi there, there's no awareness. So one of the things that I'll frequently do with patients who I suspect this of, they're lying on my table, I check the temperature of the feet and their head just with my hands. If it's consistently cold feet, hot head, and it's not that I have a cold floor or that they're coming from outside in cold weather, like there's obvious external things you have to check. If they always have cold feet and a hot head, that's telling me a lot about what is happening when their chi rises. Liver being a wood phase, is also going to tend to overact on the earth and insult metal. This is our generating controlling cycle, the pentagram, little star image. So if you have anger issues, you're also likely to get digestive issues. And if it's particularly intense, you may end up with a cough. So a patient who comes in and says, when I get angry a lot, and when I do, I just get coughing fits. We know exactly what that means. We know exactly what that looks like, and we know how to treat that easily. Someone who comes in and says, I get angry, and then I get diarrhea. That tells us a lot about what's going on with their digestive system. It's telling us how the organs are interrelating, which gives us a window on how to fix it. So Tamar has a question in the chat. I was thinking earlier, I think of dread as fear, but it's actually more of an overthinking thing. Well, these things go together. So if you're ruminating on a subject and you're scared of the outcome, like actively afraid of the outcome, if you're experiencing this like feeling of like just chewing something over long after you've extracted everything valuable from it, but also the pit in your stomach's dropped out a bit, then that's both. We could name that dread. That would work for me. Very frequently, these things combine. Some people are joyful about their anger, for example, but we're just starting at the basics. Okay, so joy is a relaxing of the chi. That's what textbooks say, that's the translation, but I like slackening better because relaxing of the chi sounds like a good thing, something that you would want as much of as possible. You want that relaxed and easy flow. We've got a very common formula called Xiaoyao-san, which translates as free and easy wanderer. This is something you want to be able to be within the Chinese medicine way of understanding things. You want to be able to freely move where it is that you're supposed to go. And joy, relaxing the chi seems to make it sound like that would help. But it's more of a slackening. So when I think of that, I'm using slackening in part because it makes us think of slackers, a term that comes from people who used to work on ships. You'd have half the team that are haulers, half the team that are slackers. They're the ones who are pulling the lines or feeding the lines. The slacker's job is easier. Someone who's always on the slack line is someone who is a slacker. So in this case, too much slackening of the chi results in laziness and lack of motivation. The tone of them goes away. They're more just sunken inwards. They're too relaxed. They're relaxed in a way that if you relax a guitar string too much, it can't make music anymore. That the proper tightness is what gives the ability to the channels, the meridians in the body.
Peter,
Mm-hmm.
so in this case with joy, it's referred to chi as general chi. Any specifications on that as to what chi we're talking? It's like more.
Yeah, so for now, we're just kind of talking general, but we're talking about the organs associated with the elements primarily. So joy is mostly going to affect heart chi. But we could do a whole semester on emotions. We could spend 2 weeks on joy, and we could really go into how it breaks down into these things. But at this level, I just want you guys to have some emotional theory.
Okay.
So we're mostly talking about the associated organs based on elemental typing. So oftentimes what this slackening does is you end up with simultaneously a little bit of a lethargic stupor and a little bit of hypersensitivity. It's like reactivity. It's like, oh, whoa, too much sort of feeling. Too much joy makes it hard to focus or move forward because you're relaxed. It's hard to do that. It's often easy to perform scripted or known rituals. I mean, you can translate a lot of this behavior to someone who's a frequent chronic excessive user of marijuana. But so doing something like washing the dishes might be relatively easy, but making a decision about how to start a business, for example, it's like, I'm not put together enough to do that. That's just too much. I'd just like to keep it simple. That sort of thing is what comes out of this joy. And it often ends up with removing motivation in general. Like, this is the reward you get. This is where dopamine lives. So if you're consistently in this state of just being a little bit stoned on joy, then you don't have a whole lot of motivation to do other things. A lot of addiction lives here in the fire element. And that's not just addiction to chemical substances. A lot of people who are long distance runners have a joy-related issue. People who, like there's a joke that you will hear repeatedly, especially if you work with orthopedics, which is like the people who are running like 7 miles a day, 10 miles a day, what are they running from? If running is the only way that a person is managing their emotions, if by consistently over-exercising or heavily exercising in this long-term cardio way, if that's the person's therapy, if that's how they're dealing with all of their emotional imbalances, that has a finite lifespan. You can't do that when you're 60. And so often we'll work with these people to try to raise their heart rate, because often it drops very low, and to help them find other ways to express these things. Really long-term runners often have a sort of flatness to them, where it's like, hey, you want to, do you want to go get some food and drink and like have a good time and interact and really, have some intense conversations? And a lot of times the people who are long-term exercisers have a little bit of a similar reaction to people who are heavy marijuana users of like, yeah, that could be nice. I'm into that. There's a flatness and a little bit of an anhedonia. Yeah, so Jennifer, joy as contentment, never thought of joy that way. So again, like when I say joy and someone else hears joy and someone else hears joy, we all think of different concepts. So I'm making a statement, something along the lines of like, let joy be defined as this. If you have a different definition of joy, then we're just talking about different concepts too. There is an aspect of joy of excessive contentment. It's not appropriate to be content in most situations. Like if there's a problem that should make you angry so that you would go and resolve it, and instead you're content, then that contentment is a problem, for example. Okay, let's go into sadness here. So sadness is a dispersing of the chi. Dissolving is used sometimes. We're mostly talking about lung chi with this, mostly talking about the metal, the chi of the metal itself. And you tend to get this from chi or blood stagnation or deficiency, as well as external events. And with this, you see a lot of lung and large intestine pathology. The lungs and the heart transmit disease pretty well between each other. So like heart fire tends to lead to heat in the lungs tends to lead to heat in the heart. That they're intimately connected in a lot of ways. And this is where we see things like heartbreak. So someone who has enough sadness that their lungs really lose most of their chi, you can end up getting heart chi deficiency and an irregular heartbeat just from sadness. One of the key things you look for to see whether or not a patient is harboring long-term sadness, which is very common within our culture, is whether or not their shoulders are rolled inwards. If their shoulders are rolled inwards, it doesn't mean they have sadness, but it very often goes together. There are lots of reasons people have poor posture. I think everyone here has taken acupoints 1. So lung 1, the front mu point, the front alarm point of the lung channel, is basically right over the pectoralis minor. Pectoralis minor goes from here to here. It compresses when the shoulder rolls inwards. Person with both shoulders rolled inwards kind of walks around like this, as if their chest is caved in, as if they're caved in around their heart. We often want to open that up. The opening process often results in sadness and tears coming up. So it often comes with a stifling feeling and difficulty breathing. That's partially the deficiency of the chi. It's also often this closed-in stance making it hard for the lungs to move themselves. And this, of course, is a protective mechanism to prevent more sadness from accumulating in that area. It's a physical barrier that shows up. Though there are other reasons that people have that postural change. Fear is the descending of the chi. We're mostly talking about kidney chi, but because the kidneys underlie everything else, all the structures in the body are built on top of the kidneys to a degree. When the kidney chi falls down, everything falls down. So we're talking about kidney chi, but we're also talking about everything. Kira is asking a question about sadness different from depression. In FCM 1, she learned depression being referred to as anger turned inwards. Yeah, so oftentimes, yes, that's a different thing. Sadness and depression are different. I would call that depressed anger specifically. depression is one of the most poorly defined words we have. Some people mean sadness, some people mean fear, some people mean I don't sleep well, some people mean I have a poor diet. So depression itself is a hard one. Depression just means things aren't working the way I want, and it's not excess and manic, and it often isn't particularly anxious. But depression's one, when a patient tells you that they're depressed, you need to ask more questions to figure out what they mean, because it's a little bit of a catch-all term for things aren't working the way I want them to. But yes, there is a type of anger that turns inward, which is often called depressed anger. Okay, fears descending in kidney chi. Okay, so fear tends to be due to some sort of kidney deficiency, but this is kidney deficiency in relation to the fear-producing stimulus. No matter how strong you are, there are going to be things that should cause some fear. This is the emotion that we try to avoid the most. Water, fear, the emotion we want to avoid the most in general, and fire, joy, the one we tend to move towards. So there's this yin and yang push and pull here. Like people want to move towards the fire, want to avoid the fear. We often have to balance that out. You tend to see things like low back pain and knee pain and cloudy thinking because there's not clear chi in the head, it's fallen downwards. And urinary and bowel issues, like incontinence. Little children who are suddenly afraid of something will often urinate on themselves. That's kidney chi descending. If you read Greek myths and Greek stories, very often soldiers would soil themselves before going into battle, even back then. That's fear causing the downward movement of chi, causing the evacuation of the bowels. You look for postural changes with this. Someone who's like really stooped over, who looks like they've got the weight of the world on their shoulders, often that's too much downward movement of chi. We are often going to see some fear in that person. And people who withdraw. Fear is a downward movement, but if it causes enough deficiency, we're just going to withdraw on a protective level. And if the kidney's weak enough, you start seeing all of that, all this downward movement, along with a weirdly flushed face, and a little bit of like manic eye movement, which is a type of false fire. I've seen this a number of times in patients who have lupus, actually. Okay. Getting near the end here and just in time. Shock is a scattering of the chi. So there's a lot of similarities and there's a lot of overlap between shock and fear, because shock often causes fear. This like sudden scattering of the chi often makes people afraid. So there's this like, huh? And then downwards sort of a movement. This scattering from the shock can be enough to cause a heart attack. People who are deficient, the idea of a sudden surprise causing a heart attack, this is the idea. It scatters the chi. And it's due to deficiency, but only kind of, because like fear, it's deficiency in relation to the problem. So the healthiest person in the world can be shocked by a sufficiently traumatic situation. So I don't care how well built up someone is or how healthy they are, there are things they could see or experience which could shock them. So it's deficiency, but that depends on how strong the stimulus is. Symptoms tend to show up afterwards. So there's this sudden like shock, and the shock face is this opening as well. This like sort of face is a symptom of the shock. It's a pulling back and an opening most of the time. And what you're looking for afterwards is that the person doesn't appear to be all there. It's like they've lost some parts of themselves. And it often comes with an irregular pulse. So someone who's shocked enough very frequently will have an irregular pulse rate, which we're pretty good at returning back to a normal pulse rate. So skipping beats, missing beats, speeding up and slowing down at irregular intervals, disconnected from the breath. Pretty good at fixing that. And one of the easiest ways to think about what shock looks like is to see it in an animal where often it's not covered up and hidden for cultural reasons. So a dog that's nervous about going outside and suddenly a car backfires, they're going to display these shaking motions, this withdrawing, uncertainty. Even if you offer them a treat, they're often going to be a little bit cagey about engaging with it. That's what shock does. We tend to hide that for cultural reasons. We don't like shaking and crying in public if we can help it. But that doesn't mean that that energy isn't still there. Rumination. Go ahead.
I was just going to say, is shock similar to like panic attacks, or is that different?
Oftentimes panic attacks have an element of shock underlying them. So oftentimes a shock over time, a shock will be the initiating incident that results in panic attacks in the future. A lot of times panic attacks are a kind of extreme form of rumination. It's like indecision caused by overthinking. So it's like panic attacks happen for different reasons. If there's a choice involved that's causing the panic attack, like at the very simplest, I'm sitting here and I'm like, I don't know if I should go right or left. And if I get more and more worked up about that, because I can't decide, that could lead to a panic attack. That's a form of rumination causing it. Fear can cause it as almost like this escape mechanism. Shock can definitely cause it long term. There's often a fear of the unknown component, this like existential dread, existential fear that comes over people as an aspect of a panic attack. But usually for people who have panic attacks, the first thing we start with is treating shock. Like to whatever degree they've had this, let's like try to like firm them up and bring them back together. Yeah, but there's a number of reasons. Like long-term trauma may be working with a whole different way of thinking about this stuff. This is just the introduction for the emotions. We're good at treating panic attacks though. Rumination, it's a nodding of the chi. Being earth, rumination's mostly going to affect the spleen and stomach, which means the whole digestive system. It causes stagnation. It's also usually due to stagnation. So people who have issues with rumination tend to be less active as well. Like the more sedentary a person is, often the more likely they are to overthink things. So getting people to move their physical body can help to get rid of the stagnation. As the stagnation goes away, you stop producing as much stagnation. You're looking for patients who do a lot of apologizing. If your patient's always like, oh, sorry, I didn't mean to put that there. Like there's often an element of indecisiveness there that comes from the rumination. Frequent loss of focus in your patients can be a sign that there's a lot of rumination going on because they're thinking about other stuff while you're talking to them. And insomnia. This is a massive cause of insomnia. People who lie down in bed and they're like, I'm tired, I'm exhausted, but my brain won't stop going over whether or not I chose the right washing machine at the laundromat earlier today. It doesn't matter. I know it doesn't matter. The decision's already made. Maybe I chose the wrong one, but who cares? And yet my brain just keeps thinking about it and going over it and over it. So I often talk about this as it's good to think about things and extract information that's usable for the future. But once you've extracted the usable information, it's time to stop thinking about the concept. And rumination is when, after you've extracted the usable information from analyzing something, you continue to analyze it anyways, often 50 times longer than you need to. So the difference between thinking about something and overthinking would be whether or not there's much of value coming out of it. So a positive aspect is attempting to extract lessons from the past, and negative aspect is continuing to ruminate long after useful information is extracted.
Peter.
Yeah.
I love how applying this to the seasons, because like, so from winter, you're going to go through, you're going to go through earth to before you get to spring, because what supports you in one season doesn't necessarily support you in the next season. So it's like learn what you can from that season, but you're not going to take it with you into the next season. Yep. A lot of it, yep. You just have like store it for when you come around to next winter, but that's like, because when you think about the earth coming into center for that rumination, like, it's just like, you have to let it go. The season is done. Yep. Get ready for the next season.
That's one of the central ideas of a lot of this. So when we're talking about attachment to emotions, for example, that's often in a way a type of rumination, because when something's over, you have to let it go. That's one of the central messages of health around emotions in Chinese medicine. A big fearful event happened. If it's gone, we need to get that out of your system and let it go. Extract the information, but then let it go and move on to the next season. So I see this this sort of issue, for example, can exist in people who are in their 30s, 40s, 50s, and they're still focused on events from high school. There's an aspect of rumination that's about being trapped in the past. So it's like, look, we're at this stage, you're at this stage of your life, but there's a big piece of you that's still a teenager, that's still focused on this time period. maybe there's important things that have to be unraveled there, or maybe it just has to be let go of. I'm not sure, but a lot of energy, a lot of your potential in your life, a lot of your ability to create a life you love is being devoted to being stuck in the past and attached to something that can never give you anything anymore. Of course, with individual patients, these things are more complicated, and you've got to be compassionate to what your patient's experiencing, and you've got to look at them as an individual, and there's uniqueness. But as a broad way of talking, I think this is pretty accurate. We got just a few more slides, so I'm going to get through these, and then I'll stick around for some questions, but I don't want to keep you guys too long here. Each of these movements of qi has a time and a place. They're all supposed to happen. The only one that you're not really supposed to experience much is shock. That one doesn't really have a benefit, but the rest of them you should experience. You should be sad, you should be angry, you should be deeply sad and deeply angry and deeply joyful and deeply fearful at parts of your life, but you should be able to move. We conceive health as moving into strong and deep emotions, or superficial and weak ones, and then out of them without the residue remaining in your body. So if you get angry, you shouldn't still be shaking with it a week later after the situation's gone. So it's the ability to express the emotion you need in the time period, and then, okay, now we're in a new season, now we're in a new time, we move on to the next thing. We're gonna talk about each of these on one level deeper in the second half of the semester when we go through each of the yin organs. We're gonna spend more time. We're doing like 3 organs a day for 4 weeks. And so as we go through lung, we're going to spend maybe half an hour talking about what grief does to the lung. But we got to go over internal path. We got to do some other stuff first, but that's coming. Just letting you know. Takeaways. Emotions are just movements of qi. There's nothing special about them that makes them different. The thing that's special is that they're noticed, that they interact with the heart and the pericardium, heart and or pericardium, depending on how you want to think about it. We'll talk about that when we get to the individual organs, but they don't exist in some other plane. So when we say this is holistic information, holistic medical system, we mean that we can connect what happens when you stub your toe with an emotion as kind of being the same thing and interacting with the same system. So emotions are integrated into the medicine in a way that we don't really even know how to begin talking about within a Western sense. Each emotion has this action on qi. Remember, for all of the exams, including in this class, I want you to say anger causes the qi to rise, but I want you to remember for your clinical practice that rising of qi is anger, because I don't want you to get things wrong on the board exams because I'm teaching them to you, despite the fact that they are wrong on the board exams. Yeah, and we'll go into this a little further. And I've got a couple of books to recommend. If you guys loved this stuff, then these are both really good books. Lonnie Jarrett teaches classes in Stockbridge, Massachusetts. I did a year-long training with him while I was in acupuncture school. He's good. He's a little bit of a, he's not nice, but he does with students. I hear he's nice with his patients, but he's not nice with students. But he's very good at what he teaches. He's just blunt in his words. We don't have time for me to be messing around, so we're getting right to the point. Great book. So I'm going to be recommending books through the semester. Normally this is like, hey, if you liked this lecture, go hang out in the library with one of these books for an hour and just mess around with it. I'm not necessarily recommending you buy all of the books I recommend this semester, because some are going to be appropriate for some of you, others for others. This is a good one. He goes through every acupuncture point, talks about the names, a lot of great stuff. He's got another book that's more theoretical. Just put the name in the chat, called Nourishing Destiny. But yeah, great stuff. Excuse me. And he's fairly heavily influenced by Dr. Shen, who is the Chinese practitioner that inspired Leon Hammer, who started the Dragon Rises School in Florida and wrote this book, Dragon Rises, Redbird Flies, Psychology in Chinese Medicine. I love his case studies. both of them are going to talk about all of this a little bit differently than I do, because I'm trying to pin this all to the 5 elements, but they start off on a more complex level with it. They're both great books if you're interested in it. Yeah. So that's emotions. Not too bad for one day, right? That's about all we're covering here. I'm going to put the slides for this week are up in the Slack, but I'm also just going to drop them in the chat here for anyone who is having trouble accessing stuff. Sorry about some of the technological confusion.
So there was a part 2 that you put in the Slack. Are we
Yeah.
supposed to do that on our own, or are we covering that next week?
Just take a look at it and we'll cover it next week. I built this class, I build my classes in general with the intention of us slowly falling behind in the class, depending on how much conversation and questions we have. Especially at the introductory level, I think it's very important we take time for questions, because of course all this stuff makes sense to me, but that doesn't mean that my explanations are going to make sense to you. So as we go through the semester, even looking at the syllabus, we're probably going to be a week behind by the end of the semester. And if you look at week 13 and 14, it says there like catch up. And if not, here's what we'll cover. So take a look at the other stuff, but we'll get to it next week.
So do we have a quiz next week as well?
There will be a quiz. It will be on, oh, you know what? Actually, most of that quiz is from the second half of this lecture. So actually, no, you will not have a quiz next week. You'll have a quiz the week after that on this week's material, which like is pretty much just name the movements of the chi. I hope you learn this at a deeper level than that, but that's really all I'm expecting from you on an exam level. And then next week, we're going to start getting into the stuff that is going to be heavily examined for the rest of the semester. Everything in the second half of the semester is heavily examined as well. Just, yeah. Sound good? Okay. Well, we are done with class. So I'm happy to hang around for the next 10 minutes, answer any questions people have, and otherwise you guys are free to go. Message me on the Slack. If you have questions about this, email me. I'm available. The more public conversation we have going on the Slack, the more we'll have good public conversation. So I encourage you to write stuff there. Take care, everybody.
Just wanted to confirm, because on the syllabus it says we do have a quiz next week. Is it being pushed back?
Yeah, we would have a quiz if we'd covered the second half of today.
Gotcha. Okay, thank you.
Thank you.
Bye.
Peter, I have a quick question.
Sure.
I don't really know like if it's a question. I don't really know what I'm asking, but back to the weed usage. Does it depend on why someone uses it? Like, let's say someone's not using it for the extra dopamine and that high effect, and someone's kind of using it to suppress their anxiety and their sadness just to reach like a baseline of joy. That would be a whole nother set of issues that wouldn't necessarily be chasing joy, rather suppress sadness.
Yeah, I mean, so what we usually see when people say and have the experience of using marijuana to get them to a baseline, that tends to not work very well long term.
Right.
And so we see that as a suboptimal way of getting to a baseline. So I would prefer that to someone, depending on what they're doing, there are much worse ways to get to a baseline. It's a relatively not so bad way to do it, but we would rather get them to a baseline in a way that is treating the root reason that they're not there, as opposed to a consistent medication to suppress the branch.
Right.
So anything that a person has to take regularly forever is addressing the branch. And anything that treats a branch tends to break down over time. So in Chinese medicine, if we're doing well with herbal prescriptions, for example, people should have to take less and less over time, and eventually they should be able to stop. And with marijuana, people tend to have to use more and more over time to achieve the same results. And it has side effects. It has cognitive side effects. Oftentimes, in my experience, I see people who are like, I use marijuana to get to a baseline. Oftentimes it's like, yes, but you're also sacrificing like 20 to 50% of your drive to get there. So oftentimes it's like, oh, I use this to get to my baseline, but also I'm just kind of low energy.
Right.
And it's like, well, but if we resolve this at a deeper level, you probably also wouldn't be low energy.
Mm-hmm.
And so, yeah, I would call it a non-optimal way to do that. It's getting more, it's becoming more and more normal for people to use marijuana frequently culturally, but anything to excess is a problem.
Right, because you're not treating the root, you're just
Yeah.
treating the branch, which breaks down over time. Okay, that definitely makes sense.
I mean, it's basically herbal antidepressants at that point,
Right.
which I don't necessarily have a problem with,
Mhm.
but there are better things that can be done usually.
With less.
Yeah, people who use it long term, if someone uses marijuana for a long time and they stop, they're going to be anxious. That's almost guaranteed.
Mhm.
So there's a certain degree to which, well, is the marijuana maintaining a baseline at this point, or is the marijuana, or are you just avoiding, or are people just avoiding withdrawals from marijuana? If someone's used it daily for 3 years and they're like, well, if I stop, I get anxious, so that's why I don't stop. It helps me maintain a baseline. Well, is that still true? Or are you just addicted to marijuana? And it depends on the person. But
Right.
yeah, I usually try to get people who use marijuana as medicine to try to reduce that over time. I don't really have a problem if someone occasionally uses it recreationally for their health. Same with drinking.
Right, but nothing, you don't want to use it to actually suppress the real reason or use it just because you're addicted.
Yeah.
Right.
Yeah. It's long term, it's not going to work, and you're going to accumulate more of whatever the root problem is. And when it stops working eventually, the root is going to be bigger and harder to deal with. And you will have maybe lost 10 years of 20% of your productivity or drive or accomplishments. So sometimes people kind of put themselves in limbo through using that heavily. And they start at 20, 16, 25, then they come out of it at 40 because it stops working, and they're like, oh man, I really wish I'd done more over the past 20 years.
Right.
Yeah.
Okay. Thank you.
You're welcome.
Sounds
Good question.
great. Thank you. Bye-bye.
Bye.
I was just doing that quiz. But I didn't know if we had to stay on this camera.
Oh, no, go ahead. You can
Okay.
do it off camera. That's fine.
Thank you.
All right. Yeah,
Okay.
thanks, Melissa.
Okay.
Bye.